Guys, welcome to Convo. This is the doctor's bench. And today we are having a conversation about health insurance, and we are trying to understand NHIF. And I just want to encourage you to share. I want to request you to share this program with someone, share the link with your friends, and tell them to come on board and have a conversation with us. And today I have a guest with me. I'm not alone. And before I do that, I'd like to remind you to also subscribe to our YouTube channel, Convo, encouraging conversations that matter. So one of those times, I think it was last month, I asked a question in the Doctor's Bench. By the way, if you have not joined the Doctor's Bench group on Facebook, please do so, because there are amazing and awesome articles there and resources to help you lead a healthy life. So some time ago, I asked a question at the Doctor's Bench, and I asked, what is your experience with medical or health insurance in Kenya? Share your experience with us, good or bad. Which one do you use, and do you think it's worth it? That was the question I asked, and I got some very interesting responses. And I was just asking the question to get to know how people are managing their bills in terms of health when they go to hospital. What do you use to pay? Do you pay cash, or do you have an insurance, a health insurance? Or are you confused or in between, wondering what to do? That was the question I asked, and I got some very interesting responses, and that is what I want us to deal with today. And as I said, I'm not alone. I'm joined in by Steve.
Yes.
Karibu sana, Steve.
Thank you very much.
I know it is not your first time to be here.
Yes.
So
yes.
welcome back to Convo.
Thank you.
Yeah, how are you doing?
I'm doing well.
How has your week been?
The week has been good,
Uh-huh.
and we thank God for that.
Amen.
Yes.
So I want us to dive into the conversation, because I know we don't have much time. And I asked the question, Steve, and I'm sure you've seen the question in the Doctor's Bench forum about health insurance, and I got some responses, and I just want you to first begin by telling us, I know, by the way, we did a video with Steve on health insurance some time back, and if you want to understand more about health insurance at large, we have a video on our YouTube channel, Convo, encouraging conversations that matter. So you can go back to our videos and watch that video. But today I want us to just talk about NHIF. For those of us in plus 254, because I know this is just a Kenyan insurance scheme. Yeah, so I want you to just help us understand what exactly is NHIF. Briefly, just an introduction.
Most of the people don't even understand what is an NHIF.
Yeah.
They have even the NHIF card.
Yeah.
And some of them, they don't know what is covered.
Yeah.
NHIF, in short, is the National Health Insurance Fund.
Yes.
Which is governed by the government. It's a government institution to offer medical service to those who are in financial instability.
Yes.
And it is very cheap. And some people misunderstand. They don't even want to hear about NHIF, because they say NHIF doesn't pay.
Yeah, it doesn't help.
It doesn't help.
Yes.
And I would like to tell maybe the viewers that NHIF is one of the best medical medical insurance institution, which is helping Kenyans even to do major surgeries. Yeah. And even a major complication which people may despise. Yeah. So we find that NHIF is one of the best, but people are misunderstood. Yeah. The issue of NHIF, what does it cover?
Yeah, I think there's a lot of misinformation when it comes to NHIF.
And you find that NHIF works exactly like a private medical insurance providers. Yeah. You find in NHIF we have the inpatient covers, the outpatient. Yeah. We also have maternity, the maternal issues. Yeah. We also have optical and dental. Yes. We also find that they're also covering maybe the CT scan, radiology, MRI. Yeah. But people don't understand this. Yeah, people don't understand. But it is about misinformation. Yeah. And again, Kenyans, ignorance. Yeah. They don't want to know.
Yeah, I think so, because, you know, one of the comments I got, and this from my friend Felix, he said, private covers work better, but they are more expensive. For instance, in my case, I have NHIF and a private cover by Pacific Insurance. NHIF is good, but sometimes does not cover for all the cost of treatment. On the other hand, my private cover, my private one covers for all costs, including but not limited to tests, surgeries, and medicine. My private cover is worth it. NHIF, ish. You know, what do you have to say about that?
Maybe the way we have said misinformation.
Yeah.
When you took this NHIF cover, what were you told?
Yeah.
Did you ask questions?
Yeah.
You know, most of the Kenyans, they just want to have the medical card, NHIF.
Yeah.
They don't know what it is covering.
Yeah.
I will urge Kenyans and also people who are enlightened to know about what they have.
Yeah.
You cannot go to a shop and buy just a trouser and you know whether it is your size.
Exactly. You don't know if it fits.
They need to go out and get more information about this medical cover, NHIF. What does it have for me?
Yeah.
Does it cover everything? Like the sofa cover, where we find that guys are going for 500 shillings per month.
Yeah.
I saw it has so many benefits that I could not even believe.
Yeah, I
but
saw
again,
it too.
the issue of the private companies, medical cover,
Yeah.
they will give you the medical cover, yes?
Yes.
But they will let you not maybe use, you know, most of the hospitals, they will ask you, do you have a medical card?
Yeah.
So the first thing you'll do, you withdraw the private one.
Yeah.
Because that is what maybe they are willing to take first. If you don't have, then that is when you go for NHIF.
Yes.
But we say in private companies, medical cover, those who provide the medical cover, we say if the card you have, maybe for the one you say Pacific, the other insurance like Jubilee, Britam, you know, the resolution, that card, sometimes we pay net. The insurance will pay net of the NHIF. What does it mean? So if it is a CT scan, it's costing maybe 20,000.
Yes.
So they will say NHIF will pay 10K.
Oh.
So the net of the NHIF, then that is when now you find now the private companies coming in on the complicated cases.
Okay.
You find even dialysis.
Yeah.
The NHIF is doing completely, is paying for everything.
Wow.
I know sessions like you find one session goes for 8,000 or maybe 10,000, depending on the institution you have gone, the hospitals you have gone. And you find the NHIF is paying. And it's only the super cover where maybe somebody is paying 500 shillings.
Yeah.
So you find somebody who has the issues of dialysis,
Yeah.
the complication of the kidney.
Yeah.
They are going for session like 4 times in a month.
Yes.
Or maybe others who go 2 times in a week.
Yes.
So that is eight sessions
Yes.
whereby NHIF is able to cover
Yes.
before maybe the private companies come in.
Yes.
So I encourage people to go for the NHIF and maybe to get more information about the cover they are going to take. It will help.
I think I've just thought about something when you're speaking, and I thought sometimes people say, depending on the hospital you go to, NHIF will cover more or less. Is that true?
It is not true. Again, when you are taking the NHIF cover, sometimes you are told which hospital you normally choose. Which hospital are you going to?
Yes, there's that option.
Yes, because we are also looking at the locality.
Yes.
You cannot choose an hospital in Garissa and in Nairobi.
Yes, it doesn't make sense.
It doesn't make sense.
Yes.
You need to, you know, why the medical cover?
Yeah.
In case of any uncertainty.
Yeah.
And that is maybe the complication of sickness.
Yeah.
So we need to, you need to select an hospital which is near you, where you stay.
Yes.
In other time, you say geographically well placed. Where you stay. If you stay in Kasarani, don't go to take an hospital in Ruiru or even in Thika. Choose an hospital whereby it is NHIF accredited, and then again is easily accessible during the day or night. Yes.
Wow. So now there's another comment here.
Yes.
Hilary Tumwet says, in my own research, NHIF works, but not 100% in public hospital. For private hospital, kindly accept those who have not been employed to be treated in your facility as long as their NHIF is active instead of job group.
Repeat again.
He says, in my own research, NHIF works, but not 100% in public hospital.
In fact, let's stop at that.
Yes.
We'll go step by step.
Yes.
In fact, In fact, you'll find that NHIF works better in public hospitals, because that is why the government that is the intention of the government.
Okay.
Because NHIF is the government.
Yeah. It's
so
a
it's a government institution.
Fund, yeah.
The fund. So the first priority will give to the government hospitals. Then the category, there is a category B, the faith-based hospitals.
Yeah.
So those are the one who come the second. Then the third is the high-end private hospitals.
Oh, okay.
So you'll find the NHIF will work better in a government institution or government hospitals.
Yeah.
It will cover more conditions or more issues pertaining health other than the private.
Yeah.
So you'll find that the private will be given those restrictions by NHIF that you need to pay net of the NHIF.
Yeah.
Sometimes NHIF may pay half. The private, they are supposed to pay half.
Yeah.
Depending on the institution you have gone.
Yeah.
If you go to private hospital, you know that the bed is covered by NHIF.
Oh.
So if you don't have an NHIF card you have gone to an hospital, to high-end private hospitals, you'll be able to. You will supposed to be paid through cash.
Yeah.
The private will not pay the bed.
It will not pay the bed.
Yes.
Okay. But I think something important that you've said is that we need to know, like when you're applying for the NHIF, you need to understand what exactly does it cover.
Yes.
You need to ask the right questions. And we talked about that in our previous program.
Yes.
And we said even the super cover, you need to know what exactly does it cover.
Does it cover, yes.
And even when you want, there are some instances you can't avoid and you have to go to the high-end private hospitals. You have to ask,
yes.
Are you guys NHIF accredited?
Accredited.
And how much, what is covered by NHIF in this hospital,
Yes,
I think it's important to ask the right questions. But some people assume.
Yes.
And then the end of the hospitalization period is when they get shocked that NHIF will not pay for my bills, I have to pay. I think it's important.
And then they start now blaming the NHIF.
Yeah.
And they calling them names.
Yeah.
And making a lot of noise.
Yeah, making
so
a lot of noise.
it is very important for us to, more so to Kenyans who are listening to us today.
Yeah.
Just know what you have.
Yeah.
And ask before you are admitted.
Yeah.
And there is what we call pre-authorization.
Yes.
In every hospital.
Yes.
So you need to know if it's a surgery, if it's dialysis.
Yeah.
The NHIF has to authorize.
Yes.
For the services to be offered.
Yes.
The same way with private.
Yes.
There is no single process which you go without pre-authorization.
Yeah, I've seen it even with the tests like the CT scans and the MRIs.
Yes.
You have to
they have to give a go-ahead.
Yeah.
They have to agree, because at the end of the day, they are the one to pay the bills.
Yeah.
Yeah.
Okay, maybe we can go to the next comment.
Yes.
Carol Fred says, I think if one is not working for the government, NHIF will not help much unless for consultation fee.
No. That is not the truth. When you look at the super cover, it has categories or the benefits it has for what it covers. The inpatient, when you look at the inpatients, that's where you find things like dialysis, things like MRI, laboratory, the normal procedures, the surgery, also investigation, the consultation. So it covers a wide range of issues. Unlike the perception we have that the NHIF will not cover, is only for consultation.
It's only for consultation.
Then there is no medication. No, that is not the issue.
There's that issue about, and Carol Freds brought that up, and it was a huge discussion at the forum.
Yes.
And she said about those people who are working for the government, and I know there is the NHIF that is for civil servants, which covers a bit more than the one for non-civil servants. Maybe you could elaborate more on that so that we'll get some understanding.
Okay. The NHIF has 3 or 4 products. There is Super Cover, which is a normal for everybody, which we have been explaining. There's also Linda Mama.
Linda Mama. Oh, yes.
The Linda Mama is about, I think it was launched maybe in 2013 by the President Uhuru Kenyatta, where you find maybe ladies, when they go for maternity, they don't pay anything.
Yes, and that's it's awesome.
It is there. And also, I saw it's also covering even the vaccination.
Wow.
You
for the child?
Yes, it's handling the antenatal and the prenatal.
Oh.
You get?
So antenatal and the postnatal period.
The postnatal, yes. So you find before the ladies deliver and after the delivery. So the Linda Mama is there and is still helping Kenyans.
Is that the one that covers even the child as until the age of 5?
Yes,
Okay,
it's the one.
Okay.
Then we have now the super cover, the Linda Mama.
Yeah.
And then in the Edu Afia, this one is covering for students in public schools.
How did I not know about that? Okay.
So this is covering the public.
Yeah.
I don't know whether it was launched, but it's one of the products that already set to happen.
Yeah.
That is why we found that there is NEMIS.
Yeah.
That system is able to know how many students we have in public schools.
Yeah.
Both primary and secondary.
Yes.
So that they can be covered.
Yes.
Then now the last one is the civil servant scheme.
Yes.
Which now this one is procured by the institution where somebody is working.
Okay.
And it has the same benefits, the inpatient, the outpatient, the maternal, but the only extra cover they have is like group life.
Okay.
It's an addition of group life.
Yeah.
And what we call as gratia cover.
Okay.
That one is like, for example, you go to an hospital and you find maybe like now we are in the COVID-19 period.
Yeah.
You find there are institutions where they don't want to hear about paying for the COVID. But you find like this cover, you'll find that there is ex gratia. Ex gratia is when you pay when maybe the member is not covered.
Okay.
So the Frida is here with maybe malaria, but malaria is not covered by NHIF. But now because you're working under the civil servant scheme, now they all just need maybe from HR to just say we'll pay for that because it is not covered, and we cannot allow one of our members to suffer because maybe they are critical in their position in the place of work. So what do? We pay for that member so that the life continues. So those are what we call as gratia payments. Okay. Sometimes even in the insurance we also pay, like claims in medical, claims in life, claims in general.
Yeah.
You find we give as gratia because of maybe the issues of uncertainty.
Okay.
Yeah.
So
then the last benefit maybe of the civil servant is maybe the last expense. They get the last expense cover, where maybe the demise of one of the member, maybe the principal, the spouse, or the beneficial as like a child, they're also covered.
Okay. So the bit about the civil servants and non-civil servants is what I think Carol Freds was bringing out.
Okay.
Because she was saying if you don't work for the government, NHIF is going to pay less. And because I know for the national scheme we'll pay 500 per month. Is there a way you can enhance your NHIF to almost pay similar to the one for civil servants?
No. Unless you are a civil servant. Okay. Remember, they are categories. They are covers.
Yeah.
We don't. You cannot just say that I want for civil servant. You are not a civil servant.
Oh, you can't do that.
You can't do that.
Okay.
The covers are well stipulated. Even in the private, there are categories.
Yeah.
There are guys who are going for 1 million inpatient.
Yeah.
There are others who are going for 10 million.
Yeah.
So there's no way you can come in between and change the contract and say, now I had taken for 1 million, and after 6 months now I want to change mine to 5 million.
Okay.
No, remember it's a contract
you
sign and you get into.
Yeah.
So you cannot change a contract in between unless it expires.
Okay.
And you know most of the private institution, the medical cover expires after 1 year.
Yeah.
We give them a leeway of 12 months.
Yeah.
So then now you can renew. So in the renewal is when you can change.
Yeah.
Your cover. But NHIF, again, you have taken the super cover, so you don't want to change.
Yeah.
And now go to the civil servant. Because I don't think there is a loophole for that.
Okay.
Yes.
So the 500 per month is for those that are self-employed.
Yes, self-employed.
So there is no. You've talked about the categories. Is there a category that's maybe pays? You pay more per month so that you get covered,
Okay, in the categories, like you see in the civil servant, there are guys who are going to pay even 1,700 per month.
Okay.
Like me, I pay 1,700.
Okay.
Maybe because of the regulations which were brought by the NHIF.
Yes.
And also again, depending on on your income.
Yes.
So you cannot compare somebody Mama Mboga and somebody who is earning 150, 200,000.
Yeah.
So there's an increment depending on the cadre you are in.
Okay.
So I don't think that there's that possibility of maybe changing in between.
Okay.
You can't change the cover.
Okay. Maybe to just go to the next comment.
Yes.
Barikiwa Mteule, that's a very nice name, says, I'm so proud of NHIF. It has really helped me. I don't know how much I can say, but were it not for that cover, I would be much worse. It has helped me and my family, and it still does. I wish I could share more about this, but I encourage people to enroll. It really does help. Wow. That's a nice comment.
Yes.
At least for once, I've seen someone say that NHIF works.
It works.
Every other time I see people saying NHIF doesn't pay, NHIF.
It works, but you see, people go to the hospital with expectation. They want, like for example, when you go for the medication, they need the branded drugs, which are more expensive.
Yeah.
And when they are given maybe the generics,
Yeah.
they don't want you. I think you understand that better than me.
Yeah.
But you find it's the same. It's the same formula.
Yeah.
Maybe the difference is how the product is packaged.
Yeah.
And to me, sometimes we need to be considerate. If you get maybe the generics or there's some drugs, let's use them, because when you use the branded names, branded products, sometimes when you get maybe the severity of the disease, it doesn't work.
Yeah.
But that is a very good comment.
Yeah.
And people to encourage more people to enroll.
Yeah, it's
and get
very
more
important.
experience.
Yeah.
And they get the help at the end of the day.
Yeah.
Yeah.
Okay. Unfortunately, I would have loved to read all the other comments.
Yes.
But for now, it's not possible because of time.
Yes.
I think we should have this forum another time to answer the other questions that are here.
Yes.
But for now, just to encourage you, my viewer, if you have any questions about NHIF or health insurance, even the private covers, our expert is here and he's ready to answer the questions. We can host him again and again and again.
Yes.
And we'll get to understand more about health insurance. Please, please, please enroll if you have not already done that, because I hate to see people staying in hospital because they can't pay their bills. When you can even get the most basic cover, which is NHIF.
Yes.
Yeah, so please enroll to NHIF or a private insurance cover. And if you need to consult, it's, as Steve says, it's very, very important to have all the information before you make that decision. So if you need to consult and if you have questions, you can also reach out to us. On our pages and on our platforms and on the numbers on the flyers and on the screens. And I would like Steve to give a parting shot so that we can, pause for now.
Yes. To my viewers, I would like to encourage you to enroll, and not even on the NHIF, but also look at the private. Maybe they have better deals, which are cheaper.
Yeah.
Some people say that private is very expensive, but some of them are very cheap.
Yeah.
Going like 20,000, you have a medical cover for in and outpatient, and other benefits like last expense, group life, optical, dental. So it all depends on what do you want. Don't just listen to the people, what they are saying. Just go to the institution and get the information and get the facts and know what you are going to be covered. By the end of the day, you'll enjoy. There's also there are some institutions which are even covering COVID. Private companies, insurance companies. I have several. So if somebody needs, maybe they'll be able to contact and we will guide them. Thank you very much.
Okay. Thank you so much for coming to Convo.
Thank you very
and
much.
you're always welcome here. You're part of this big family.
Yes.
Yeah. And my viewer, for now, allow us to say goodbye. This is just a pause. It's not a full stop. We'll continue having this conversation over and over and answering your questions. So please subscribe to our YouTube channel, Convo, encouraging conversations that matter. And until next Saturday, same time, see you.
Thank you.